And here's where habit comes in. If you usually slump when you're sitting or walking, as this boy does, your body will accustom itself to poor posture so that it actually becomes difficult for you to sit up tall or walk correctly. To develop good posture habits, the kind this girl has, there are several things you must do. First, exercise. Go in for active, stretching, bending games.
It's not a secret to any of us. Posture is important. Prolonged poor posture can lead to pain and dysfunction. So yes, your mother was right. You should mind your posture. Though their history does not actually go back to the 1950s, postural rollers or rolls have been used as implements to self-stretch and mobilize for at least a quarter century. These simple tools are inexpensive, lightweight, and easy to use. Shown here are 36-inch long, full 6-inch round, and half-round styrofoam rollers. These can be purchased at most physical therapy clinics and sporting goods stores, with prices ranging from $10 to $50. Rollers vary in materials and densities, though the principles of using them remain essentially the same. Rollers are used in many ways. This video is a demonstration of a single method. It is recommended for those with lower back issues to mount any roller using a side mount method. While stabilizing the roller with one hand, simply align yourself so the roller contacts you from head to tail, and roll on. Lie on the foam roll with it parallel and directly under your spine. Your head should be resting on the roll, with your feet on the floor, knees bent. You may feel some relaxing stretch of various tissues. Do not perform these exercises if you experience increased pain. The diameter of the roller depends on how you will be using it. For those individuals with shoulder issues, a half-round roller is often preferred. This is to avoid excessive shoulder extension when resting the hands or forearms on the floor. In this example, we will start with bilateral shoulder abduction. This is like performing slow-motion snow angels with just your arms. Move slowly to allow your body time to stretch, as well as avoid pain. Perform these movements for 10 repetitions each, or set a timer and perform for 1 minute, or longer depending on how your body responds. Next is alternating shoulder flexion. Move your arms in an alternating fashion and within a pain-free range over your head. It is helpful to lead the motion of your arm with your thumb pointing in the direction of the upward movement. This tends to allow for greater range of motion overhead. Next is shoulder protraction and retraction, or reaching forward and back with your shoulder blades. Try to keep your elbows straight throughout this movement. Also avoid forcefully pushing back your head into the roller while reaching forward with your arms. You can also try some shoulder rolls, first in one direction, then the opposite direction. Remember to move slowly, maintain control of your movements, and avoid any movements that result in an increase in pain. Next is what is known as horizontal abduction and adduction, moving your arms out in the horizontal plane. Start with your arms forward, palms facing each other. Slowly move your arms out and towards the floor from this position. Once your hands contact the floor, return slowly to the start position and repeat. Next, return to the snow angel position that you started this series with, this time with your elbows slightly bent. Reach your hands overhead for the 10 repetitions or timed amount as you have for all the other movements. To dismount the roller, simply reverse the steps you used to mount the roller. Next, we'll try a technique to improve thoracic or upper back rotation. On all fours, place the roller next to you parallel to your trunk. Start with your hand opposite the roller, threading it between your other arm and thigh, placing the back of the hand on the roller, palm up. Following your hand with your eyes, turn your shoulders so you reach to one side with your hand. Widen your knees slightly to improve your stability. Think of turning your shoulders while holding your lower back and pelvis stable. Try increasing your reach and trunk rotation as you progress, again, avoiding any increase in pain. Switch the roller to the opposite side and perform the same technique. Notice if you have one direction that is more restricted and increase your focus on that side with this exercise. Now let's try some thoracic extension. Move the roller perpendicular to your spine, grasping it with your elbows to stabilize it. With the roller at mid-shoulder blade level, interlace your fingers and place your hands behind your neck. You can increase pressure on the roller by bridging or lifting your bottom off the floor. You can also vary the position of the roller on your thoracic spine by simply rolling it toward the top or lower portion of your shoulder blades. Try carefully extending over the roller at different levels of your spine. This should be done carefully and within a pain-free range. As humans, we are built to move. Unfortunately, many of us are confined to a workspace for several hours each day. Despite our best intentions, maintaining good posture can be an uphill battle. Whether you sit at a desk, in a car, or on an airplane, gravity and a lifetime of habits are against you. Rollers are just one option to help you against the tide, though proper ergonomics and regular exercise are also important components. Speak with your physical therapist about a variety of options specific to your situation.